Good morning, my dear friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. You can also make use of it. Anyway, my dear friends, we were discussing about the holistic approach in children. So, in the present day context, inculcation of the holistic properties in the growing child is a need of the hour because our children are failed to succeed in the future. Although they are very knowledgeable, very much educated, they are not able to withstand the stress of this life due to various reasons. One of the main reasons is we fail to inculcate the holistic properties in the child. He don't know how to face the stress. He don't know how to move in the society. He don't know how to maintain the relationship. He don't know how to balance the life, and he don't know how to face the frustration, and he don't know how to celebrate the victory. So these are some of the basic points which make our kids fail in their future life. So keeping this in mind, so we have started a series of this particular talk lectures. So where I already completed 3 or 4 parts. Now today we will look into the social health. So health means it is a complete package which includes emotional, social, psychological, lingual, religious, spiritual health, etc. So today we will discuss about the social health. Now social health is very, very important. Now probably the social health has been overtaken by the social medias nowadays. Okay, people nowadays do not think that it is very much essential to maintain a face-to-face relationship with any particular person. Rather, they can maintain the same relationship in the social medias. So, without commenting more on that, how to inculcate the social health, okay, develop the social health properties in a child. So that we will discuss. So we have got a separate developmental milestone domain is there. It's the social domain. So we have got developmental milestones where we talk about social domains. Social developmental milestone. For example, baby giving social smile, then waving tata, bye bye, and responding to the mother and smiling at the unknown person. And these are all the early part of the social health. Okay, there are some disorders where social developmental milestones are greatly affected. For example, in case of autism, the social developmental milestones are totally zero, and even some of the autism spectrum disorder like Asperger's syndrome, like syndrome, where the social development, although it is normal, the child is not able to talk in the society, move in the society with eye contact, and also with easy. Okay, so he feel very much suffocated when he move in the society. So that type of disorders are also there, which is mainly named under the heading of the Asperger's syndrome. Anyway, so that's a different issue. But in a normal child, as a parents, how we can inculcate these properties. Now, how to move in the society, this is a very important issue. Okay, now again, so nobody can taught all these things in the classroom. So basically this practice or training should be given in the home environment itself or in the family environment itself. Now students are, or the child is, or kid is allowed to talk, and kid is allowed to play with everybody. That's very important. Nowadays we are not allowing our kid to play outside. Reasons may be many, including security and all. But anyway, unless and until the kid involve himself in a group play, the social developmental milestones and also the social health cannot be well developed. So he know how to move in the society. That means suppose he is involved in a group play, so that taught so many things to the kid, that how to adjust with other person, how to talk with other people, how to respond for them. So when difference of opinions are there, and how to tackle that. So the primary education about all these things will be given in the very beginning itself. One of the best practice is making the baby involving in a group play. Okay, group play. Then you can even identify where actually the child is lacking. Many times the parents complain he is not able to play in the group. Singly he can play, but in the group he cannot play, because that's the problem. That means that he has got some problem in the social health. Okay, now we need to correct it. Okay, so this is number one. Okay, so you can allow the kid to talk as many as people possible, and always encourage the child to get involved himself in the group plays. Okay, and he should be made understood regarding the social rules and customs. When many times we will call it as super ego, and that we will discuss later. Super ego. So development of the super ego is when your personal character is subjected to, okay, that is also called as ego. When your ego is subjected to the social rules, a new personality get emerged out. When the child's ego is get exposed to the social rules or social customs, the child develops a new personality out of this, and that itself is called a super ego. So that we'll discuss later. So now he should be made understood about the social rules and customs. Now if you look into the samskaras explained in Ayurveda regarding Kamarvritya, one of the samskara is Upanayana samskara. Upanayana samskara. In the Upanayana samskaras, usually it is done as early as 8 years of age, where the child is taught with some of the social responsibility and moral responsibilities. Okay, so socially what he has to do. So usually if you look into the classics, the mantras which is given in the Upanayana samskara, they will say that the child will be taught to not break the social rules, okay, and treat everyone, including the animals, with the same sense, and don't throw the stones at the animals. Okay, don't make others cry. So all these things. So social rules and how he has to move in the society, and also how he have to move in the society by following the moral responsibilities. So that has been well taught in Upanayana samskara. So that society, the personal identity. Now this is very important thing. Whenever the child moves in the society, he will be comfortable if he has got a personal identity. Okay, now suppose in the group play also, suppose they are playing the cricket. If somebody is very good in bowling, somebody is very good in batting, somebody is very good in fielding, so that gives a personal identity to him. Okay, so now child has to develop that personal identity where he is very unique. So okay, then he will be recognized in the society. So first of all, you have to child has to develop this personal identity. For that he has to try. The try is sufficient. Although he didn't develop any personal identity, no problem, but he has to try for that. Okay, so therefore this is very important. If you want to have a comfortable move or transition into the social life, so you should have a personal identity. Then it is quite easier. Okay, then important is eye contact. Socially, in many kids, there will be a problem eye contact, especially in case of autism. There is no eye contact at all. But even a child with some other mild social problems also, like Asperger's syndrome, etc., neurobehavioral problems, usually the eye contact is absent totally. Reciprocally, he is answering, but without any eye contact. In autism, there is no reciprocal answering and there is no eye contact. But in some other socio-behavioral problems, so what we will have is the child is talking, he is giving the answer, but there is lack of eye contact. So lack of eye contact itself suggests that he has some hesitation in talking. Okay, he hesitation talking. The social holistic futures, that is holistic futures related to the social life, social development, has been not well developed. So now we have to work out on the same. Socially, sometimes the child is withdrawn or social withdrawal will be there because of the inferiority complex. Sometimes inferiority complex will be one of the great hurdle in development of the social problems. Maybe child it may be related to the body color, it may be related to some body structures, or sometimes he may be too obese or too thin, or sometimes too dark, too fair. So these things that which some of the cosmetic problems, etc. So that create, or maybe sometimes very poor in studies. This create an inferiority complex in the children, and therefore the social movement will be restricted. So as the child is anticipating some bullying or insult when he moves in the society, he prefer to be there in isolated place or isolated environment, where a safe environment for him. So this type of problem should be identified at the earliest, and we have to correct it. Okay, there are so many personality development programs taking place, or behavioral program developmental programs taking place. What do we say? Vyaktitva Vikasan programs are taking place. So they are quite helpful for such children. Okay, quite. Anyway, whatever may be the drawback of the child, we have to encourage the child in move in the society, and we should, as a parents, we should also create such a conducive environment where he can move. Now, suppose a group of people are their friends are there. They inform the friends previously that allow my baby to move, although he has got some problem. Don't bully him, don't tease him. So, like that, such small efforts will go into help to develop the social environment. So, he has to move in the society to understand the existing social stigma and interpersonal relationship. The personal relationship, now usually what actually happens is, nowadays what is happening is our kids are not exposed to the social life till they reach the age of adolescence. And once they reach the age of adolescence, now they are exposed to the social environment, and that is also the age where student or kid like to be there with the peers. That means friends. Okay, so peer pressure will be there. So with the friends, and suddenly he is when exposed to a social life which so far he has not exposed without any prior training. So that creates a lot of problem, and chances of misdirection, chance of what do you say, misusing this particular adolescence period is also more. So that child may be the victim of so many bad habits and bad social antisocial activities, etc. is also more. So what I mean to say is, before exposing the kid directly into the social life during the adolescence period, we have to stage by stage we have to expose our kid to the social life. So one of the best ways is allow him to play with everybody. Okay, don't restrict. At least you have to give 1 hour play time with the group. Okay, so that is very important. Nowadays, what actually previously in the school curriculum, it was very clear that students should be involved in the game equally like that of the academics. But nowadays in the school also we are giving looking at the trend that students are only loaded with the academic matters, and even in the games period also they are taking the classes. In so many, in urban area, if you look into the schools, in so many schools there is no playground at all. Okay, there is no playground at all. And even the parents, so they are also giving more importance for the reading only, and not for the playing and other interpersonal relationships that child has to develop, especially in the high school period or in the primary classes. So these are all the drawbacks that we have to understand, and these are some of the tips that we can have a very good social health. Encourage the child to talk with everybody, encourage the child to move in the society, encourage the child to go for the group plays, encourage the child to attend so many what you say personality development programs, okay, in groups, and school activities, group school activities. So child has to participate in all these things, like this essay writing maybe there, extroverts will be there, speech will be there. So child has to participate. At least he is going in front of the stage and talking few of the sentence, that is sufficient to develop the confidence. So these are some of the basic things that we have to understand in the social health. Thank you very much. In the next class, we will talk about another important thing, that's about the philosophical health or the religious health. Thank you very much.